All right, so I just got my test back, and from the title, I tested positive for the coronavirus. There are a couple things I want to talk about that are specific to me and my experience. This just happened this morning. It is 4:30, and I got the call at 10 o'clock this morning that I was positive. So I just want to start off with my journey, tell you guys about what I've experienced, and see if you can learn anything or use my experience as a teaching tool or some guidance to guide you in your certain situation. So I work in healthcare, not direct patient care. Um, Not like a hospital, but we see patients occasionally. I haven't been doing that part of my job since the pandemic kind of ramped up. A lot of working from home, although I have been going into the office every once in a while. Um, when the so although I am younger, when the vaccine was available, I went ahead and got it when I was eligible. So this is, as a healthcare professional, we were kind of high on the priority list of people to get the vaccine. I didn't hesitate. I got the vaccine. I got the Pfizer vaccine, 2 doses, and both doses went relatively smooth. In fact, almost completely smooth. I didn't have anything except for a sore arm for the first one, and same for the second one. But I heard a lot of people having like day colds, flu-like symptoms. It does activate your body's immune system, so there are some immune responses, but I didn't have that. Maybe 3 or 4 days after I got my second shot, I was laying down and I woke up, or I sat up because I had a pain right here in my shoulder. And when I felt that, it felt like I don't know, the easiest way I can explain it is like a piece of rice. It was a little bit longer, maybe a half an inch, but it was under skin, what I thought under skin, uh, and I was just, feeling it. Like, what is that? And it was pain as I touched it. So of course I do everything. I'm touching it, rotating my arm, putting it up, putting it down, and just like trying to figure out what is in my arm. And after a while, I put my hand down as I did now, and I was just kind of moving it around. I went to go feel for it again, and it was gone. I didn't think anything of it, although my fiance did tell me then that it had to be from the shot. And since I was an advocate of getting the shot, I didn't want to hear it. I was thinking there's no way it's related. Uh, and I kind of moved on, and she kept her stance of skeptical. I kept mine as optimistic, and we kind of put that on the back burner until the reports about the Johnson and Johnson came out just yesterday or the day before about causing blood clots. And again, I didn't think about it and didn't relate it, but she told me, remember you had that blood clot? Um, that was I told you that was from that shot. And that's when I started to believe her a little bit more, that could be associated with the Pfizer vaccine as well. So um, I did have that side effect, so I'm starting to become a little bit more of a skeptic to the vaccines and exactly what their side effects are. I know there's a really small number of people, uh, and I still lean towards the fact that it is a lot better for people to get the vaccine, especially on a mass scale, than to not. Um, but on top of that, uh, I test positive. I get the vaccine. I'm hearing it's 95% effective, and I was feeling kind of not right, and I had the loss of smell. So when I was scheduled to go into work the day before, I told my employer about it, and they made me get tested. That test came back positive. So now I'm in this kind of limbo where you're stressed out about who you came in contact with, telling everybody, um, worrying about people that are older or more sick that you came in contact with, which is specifically the case for me. My grandmother-in-law has had very close contact with me, my fiance, and my son. Um, so we're just really worried about her. Um, but my symptoms uh, are, and this, I'm experiencing them now, but very mild for now. Uh, Very light cough early on, nasal pressure. I have some congestion, and but I always have at least one clear nostril. So the loss of smell is always weird when you do have that clear nostril. You're like, why can't I smell anything? Do I have corona? Um, and that kind of turned me on to the idea that these small symptoms that I normally think are nothing may actually be COVID-19. Uh, so it's just difficult on the um, psychological side of it, the emotional side of it, dealing with the ramifications of your positive diagnosis, and uh, kind of balancing that out with the fact that, like, I believe I'll be okay. Um, but it's still tough on the mental, uh, not knowing how others around you uh, might might be. Uh, but again, kind of loops back around to, is that vaccine for somebody like me worth it? I'm still under 30, really good health. I have zero health issues. Um, but I got the shot not for me, but for the people around me. Uh, and now that I still contracted the virus, I think, was it worth it? Was it worth it to get the shot and experience the blood clot? Um, because that could be serious. That clearly is moving around uh, in my veins, and if that goes up to the brain, to the lungs, to the heart, could I have had some type of serious complication? And is at that point, um, you know, you're you're I'm weighing the the benefits to what could happen with a blood clot versus getting the shot, and what could happen to those around me if I contract the virus and spread it. Um, so it's really tough. Like, just wondering if it is all worth it. Um, so that's kind of where I am. It's really quite uh, simple and normal for the most part for me, and maybe that vaccine is helping me fight it off a little bit better. Uh, but there's definitely some things that may still need to be looked into and thought about as we vaccinate more and more people. Uh, I'll keep you guys up to date. Please like the video, it helps the channel. And check out my other videos. A lot of random stuff, but I think pretty cool. Peace.